Welcome to the Innovation in Focus series. I'm Ferdy Gallagher, and this is my colleague, Konstantin Nicolaou. We're here today talking about long-axis field of view PET. Konstantin, tell me, why is long-axis field of view PET an important topic for the Innovation series?
First of all, it's important that the series wants to highlight not only radiological innovations, but also innovations adjacent to our special technologies with our friends and colleagues from Clemens. This specific paper was written by Dr. Chung, UC Boris, USA, and Dr. Clemens Mingels from Wang and colleagues, and they highlighted a new PET technology that really changes a lot of options and things we can do with PET, not just enlarging the field of view, but this opens up a multitude of options, clinical options, applications, and also research applications. And that is why it's exactly worth the perfect topic for our series.
So it's great. And you mentioned applications there. I think a lot of our listeners would be interested in where this does have a role in clinical practice. So can you highlight to us the areas where you think it will be important?
Of course, I will try. First of all, you have to read the paper, of course, but I'll try to highlight and make you interested. So what this is about is not just adding a number of detectors in PET and making those larger. Of course, that's the main thing that happens. But this changes sensitivity of the technology by a multitude. So you can change the whole body just in one deposition, do a 2-minute acquisition, another 50 or 20-minute acquisition. But you could also do still a 20-minute acquisition, but go very much lower in dose. So the typical application would be 3 megabecquerel per kilogram. You can go to a tenth of that, 0.3, 0.5. Thing of pediatric patients. So you can even be much faster or much lower in radiation. But also you could think about having a large field of view and do several repeated acquisitions, 2 minutes and another 2 minutes and another trace with one trace detection. You can do dynamic imaging of the whole body, or at least more so, and see how a tracer goes into a tumor, goes into inflammatory tissue, how it distributes, biodistribution. So there's a lot of applications that is not just having a larger detector. It just opens up more options for the technology.
It's very exciting technology, I agree. But do you think this is just a research tool, or does it actually have clinical practice use?
I think it has a lot of, as I said, especially in vulnerable patients, or if you think about new biodistribution topics, it's both research and clinics. I think it's a tool that will advance PET technology, our knowledge on how PET tracers work, and it will probably be there for a while, but it needs time to grow because it's an expensive technology. You need a lot of detector material. So it probably is not going as fast as we would like to see doing so, but I'm sure it will have its place and it will be in dedicated centers and it will prove benefits for our patients.
Great. So please look out for more in the Innovation in Focus series.
Do so.